Well, I've just got back from the hospital and I've had my very last high beam radiotherapy session, 20 of them in all, spread over a month. Now, just to let you know, some people have more doses, so some of the people there were having 33, 37 doses, but they have a smaller amount, I understand. I had 20 doses at a fairly high level. I'm not sure how they decide how many doses and what the level is. It's obviously based on your tumour and the progress and the type and the Gleason number and all these other things. Now, I've waited till now because I wanted to talk about the side effects I've had during radiotherapy. So before I start, here's a warning to everyone. Unless you're interested in bowels and bladder, it might be best not to listen to this. But certainly if you're about to go through the prostate cancer radiotherapy system, then it's worthwhile, because hopefully I'll give you some tips and tricks to help you understand how to fare better than you might otherwise. And at the end of the day, the treatment's over. I'm feeling great still, so it was definitely worthwhile. And the point I make every time, I just re-emphasise, ask your doctor for a PSA test if you're male and over 50. It's worth doing. You might go through some loops because sometimes it's a false positive, but it's worthwhile, because having any treatment, scans or biopsy beforehand is certainly better than the cancer spreading around your body. So let me explain, first of all, the problem with prostate cancer radiotherapy is you have to have your body in the right condition. And you're going to spend the whole time, whether it's 4 weeks or 6 weeks, worrying about your bladder and bowels. Because at the end of the day, you've got to get them in exactly the right state. So let me explain. If you look at the prostate, it's surrounded on one side by the bladder and on the other by the bowels. And what you need to do is get your bladder to be fairly full, about 260 millilitres of water. Any less than that, then the bladder starts folding around the prostate, getting in the way, and therefore will be touched more by the radiotherapy. So you want to be your body at that right level of about 260 millilitres. And you do that, first of all, by making sure your body is fully hydrated. How do you do that? You drink 2.5 litres roughly of water a day. And that makes sure that when water goes in, it goes straight through into your bladder. When you arrive at the hospital before your treatment, you should be there about 30 minutes before, or slightly earlier than that, and start drinking your water. So by 20 minutes before your slot time, you should have drunk 1/2 litre of water. That gives 20 minutes for that to percolate through into your bladder to be in the right condition. And if you're not feeling that you need to go on the toilet, the nurse will do a ultrasound check just to see how much is in your body. If there isn't enough, then she will send you back to sit there for a bit to get the number up. Now, first of all, I'm going to say that all of the staff, the radiographers, the nurses, etc., are marvellous. They really look after you. They're patient, understanding, helpful. Everything I've got is praise for them. And they will guide you through this whole process. Now, your bladder, I've talked about, your bowels, the emptier they are, the better. In fact, when you go on the machine, the first thing to do is a CT scan, which they compare against the original one you had done in the planning session to make sure it's okay. If it's got too much wind, gas in, or too much euchresia, then it will let them know, and they'll send you to the toilet to try and empty it a bit more. So you've got to get both of those things just right. And then when you go in the session, they'll lay you down, get you precisely right, using those tattoo marks and the lasers in the room to line you up. Then you should stay still. You can obviously breathe, and it's about 4 or so minutes for them to go out the room, do the CT scan, make sure everything is okay, and then have the high beam radiotherapy session take place, and it'll go round, beamed right at that tumour in your prostate. When it's all over, you'll be relieved. You'll be able to rush out to the toilet and empty your bladder. and you'll have to go through this all these time. As you go through, your body is changing because of the treatment. It starts to affect the state of your bowels and your bladder. And I'll just talk in a minute or two about some of the side effects I've had. But remember, everyone is different. Right, so let's get personal, and I'll talk about my own side effects. Now, first of all, of course, because you're drinking so much water, your bladder fills up quite easily. So you spend a lot of time wanting to go to the toilet. Also, drinking that amount of water, takes it out of you after a while. It's sort of a hard slog, but it's definitely worthwhile, because if you end up with a, say, urine infection like I did, then the more you're sort of flushing out your system, the better it's going to be. So you must carry on drinking at least 2 litres of water a day. Another tip I found going through it all was that the very chilled water you get at the hospital out of the machine is inclined to go through you even quicker and make you want to go on the toilet quicker. So I found lukewarm water was a better bet. If you can't get anything other than the stuff out of the machine, you can always cup the bottle in your hands. By the way, everyone is given their own half-litre water bottle to use during your treatment. So straight away when you're in the waiting room, you'll see all the other guys like you holding their water bottle. And in fact, we became almost a club. Some of the guys I got to know, we've exchanged contact details, and we have a reunion or something like that, because again, it was really helpful having people there talking about their problems, tips and tricks they'd found in their treatment, new people coming in just starting, trying to reassure them and explain, how it was all going to go. So it really became almost like a club where we all chatted together. Not just men, women as well, over there for radiotherapy under the other parts of the body. But obviously us prostrate men were a club in ourselves. And today when I had my last session, I was shaking hands and, saying goodbye to everyone, and everyone was cheering us on. It's a great feeling. It's almost worth going just to have that sort of bonding between all of you. So they're the sort of problems you'll get. It'll be a bit of a struggle each day. It's a bit like climbing a mountain. As you get near the top, you start to get tired and weary, going into hospital every day, going through this rigmarole of bowels and bladder. But of course, it's worthwhile. And when it's over, and you can sort of celebrate. So I'd say, just keep in there, keep your chin up, keep smiling, do everything you're told. And think about your bowels and bladders every day during treatment. Now I finish treatment, in 6 weeks' time, I'll see a consultant. I've been given a blood chit to have a PSA test done a week before that visit to the consultant. And obviously then they'll be able to let me know how things are going and what's happened to my PSA level. Then after about 3 months, I believe, I'll have a CT scan. They want to wait for everything to subside a bit and get back to normal so they can have a look and see, what's happened. So I must probably do one of these in, say, 3 months' time when I know a bit more about things. But in the meantime, if you're about to go through your prostate cancer journey, all the best. All I can say is you will probably survive. Most people die with it rather than from it. I feel great. I'm lucky I didn't have to go through chemo, which I believe can be a bit sort of tiring. But I feel it's been really worthwhile. I'm feeling very positive. I believe everyone has done a marvellous job helping me, and hopefully it's added years to my life. So definitely have your PSA check, and I'll be checking back with you in 3 months' time and telling you how things have been going in the post-radiotherapy period. So I'm signing off for now, and good luck and best wishes to everyone. I'm off to the pub now for a pint.